The House Appropriations Subcommittee on Licensing and Regulatory Affairs and Insurance and Financial Services will come to order. Mr. Clerk, please call the roll.
Chair Skaggs.
Here.
Representatives Brixey.
Here.
Morse. Here. Artis. Here. McKinney.
Here.
Schutte. Here. Horton. Here. And DeBoer.
Here.
Mr. Chairman, all members present, you do have a quorum.
Representative Schutte moves to approve the minutes from February 20th meeting without objection, so ordered. So wanted to welcome to the subcommittee the Department of Licensing and Regulatory Affairs, led by taken off the interim title, the new director, Marlon Brown. Congratulations on your much-deserved appointment by the governor. So if your team is ready, we are ready to listen.
Well, great. Thank you so much. Good morning to you, Chair Skaggs. Good morning to Majority Vice Chair Brixey, who I'm also proud to call my state representative. And also good morning to Minority Vice Chair Schutte and to all the members of the House Appropriations Subcommittee on Licensing and Regulatory Affairs and that Insurance and Financial Services piece that is another department. My name is Marlon Brown, and it is my honor to serve as the new director of the Michigan Department of Licensing and Regulatory Affairs. And today I'm joined by Dan Horn, who is our Director of Finance and Administrative Services. And also behind me, we have several people on the groom side of the aisle. We have Paige Fultz, our Director of Policy and Legislative Affairs. We have Deputy Directors Adam Sandoval and Courtney Pendleton, and several other proud members of Team Lara. Our department is tremendously grateful for the partnership that we have with this Appropriations Subcommittee, which has afforded significant investments in Michigan's future. And today, I am pleased to present our fiscal year 2025 budget, which continues to advance our department's mission and deliver results for the people of Michigan. Now, I know you are equally excited to dig into all the numbers and finer details, but first, I just want to take a few minutes to highlight how the work of Lara impacts all of us. So typically, during these presentations, we like to talk about Lara's recent history, which is articulated on the slide being displayed. But since Chairman Skaggs, you are a student of history, I wanted to reach back a little bit further than the Executive Organizations Act of 1965. In fact, some of our regulatory functions can actually be traced back to the late 1800s with the creation of the Board of Registration in Medicine, the Board of Pharmacy, and the Railroad Commission. Now, the Railroad Commission served as the predecessor for what we now call the Michigan Public Service Commission. And the Board of Medicine, as well as the Board of Pharmacy, still exist today within our Bureau of Professional Licensing. And as you move into the early 1900s, you see the creation of the Board of Nursing, the Liquor Control Commission, which just celebrated its 90th anniversary last year, the Plumbing Board, the Board of Accountancy, and many others. Now, I could go on and on and on with this fascinating history, but I will spare you all. Suffice it to say that Lara has a long history of working to ensure a great quality of life for all Michiganders. And before I move from this slide, I want to draw your attention to the picture. Some of the individuals on this slide were recently recognized during our inaugural Employee Recognition Awards ceremony. Team Lara is filled with exceptional public servants who take great pride in what they do for the people of Michigan. And so I want to personally thank all of our employees at Lara and say how honored I am to lead the best department in all of state government. Now, our mission at Lara is to protect people and to promote business in Michigan through transparent and accessible regulatory solutions. We aim to be national leaders within the regulatory community by partnering with those that we serve and by fostering an engaged and inclusive workforce. Our mission and our vision flow directly from our core values, which serve as the foundation for everything that we do. We are steadfast in living out the principles of public service, an engaged workforce, transparency, accessibility, and responsibility. But the bottom line is that we are laser focused on two things: protecting people and promoting business. Now, we often say that Lara licenses and regulates nearly 2 million individuals and entities. And so this slide gives you a snapshot of what that looks like. We regulate various health professionals and facilities, occupational licenses, business types, and specialized industries such as liquor, cannabis, and even unarmed combat. So on an average day, it's very likely that each of us interacts with an industry that Lara safeguards. And I like to say that whether it is the hospital you were born in, the profession that you work in, the home that you live in, or even the cemetery where your loved ones may be laid to rest in, Laura's work impacts Michiganders from every corner of this state. Now, our department's strategic plan, which is also submitted as part of the 25 budget, outlines the following key goals. First, we want to reduce barriers to licensure for both individuals and businesses. Secondly, we want to improve regulatory compliance by creating opportunities for stakeholder consultation and education. Thirdly, we want to enhance the customer experience for all department programs. And fourth, we want to provide effective, efficient, and timely services to all. These strategic goals are at the forefront of our programs and services at Lara, and as you will see in the coming slides, our fiscal year 25 budget requests are directly tied to advancing these 4 goals. Now, 2023 was a very successful year at Lara, and while I cannot articulate everything that we accomplished, we have provided the members of this committee with a handy-dandy little card that gives just a brief outline of some of our more noteworthy items. Allow me to just articulate a few. The Bureau of Professional Licensing facilitated the Michigan Task Force on Foreign Trained Medical Professionals, which developed recommendations to reduce barriers for immigrants and address staffing shortages within the healthcare workforce. Our Bureau of Community and Health Systems developed more than 50 online training videos for providers and their staff. And topics of these videos included facility renewal inspections, fire safety, caring for residents with mental illnesses, communicable diseases, and many more. The Michigan Indigent Defense Commission launched the remaining 2 standards that set maximum attorney workload limits and require local systems to ensure that public defenders are appropriately qualified to accept and defend the cases to which they are assigned. And the Michigan Unarmed Combat Commission promulgated administrative rules allowing Muay Thai and kickboxing sport events to be conducted in the state of Michigan. So start getting your tickets now. This is by no means an exhaustive list, but just a small sample of how Lara delivers for Michiganders each and every day. Additionally, we are already getting things done based on the investments that you supported during the fiscal year 24 budget process. For example, I've already mentioned the Task Force on Foreign Trained Medical Professionals. Well, with the support of this committee and the legislature, work project funding was secured to implement several of the report's recommendations. And with this funding, we hope to connect more qualified professionals with openings in high-demand health occupations such as nursing. The Michigan Public Service Commission has moved forward with energy infrastructure enhancement and development grants for projects that meet the goals of the governor's My Healthy Climate plan. The low carbon grants have already been awarded to 15 applicants across the state, and most of the grantees began their work in the second half of calendar year 2023. On the other hand, the renewable energy grant applications were due on February 21st, and awards will be finalized this summer. Thanks to your partnership, the fiscal year 2024 budget included funding to establish a new Cannabis Regulatory Agency reference laboratory. Lab blueprints and space design for this lab are almost complete, and building could begin as early as next month. Last year's budget also included $1 million in funding for CRA social equity grants. Grant applications are currently under review, and funding will be spent on employer education, business needs, or community investments. And our continued investment in the My Prevention smoke detector installation program has saved lives. In fact, on January 25th of this year, an Albion family escaped from a home fire unharmed because of working smoke alarms that were just recently installed by the My Prevention program. And since January 1 of this year, approximately 6,683 smoke alarms have been installed throughout the state. Last but certainly not least, we are engaged in several IT modernization projects to improve the satisfaction and experience of our customers. This year, we expect to finish the replacement for the Nurse Aid Registry System, as well as the Liquor Control Commission's sales, inventory, and purchasing system. I want to thank you, Mr. Chair, and the members of this committee for your leadership and for your collaboration regarding the work of our department. And we look forward to building on this success as we work to craft another timely and impactful budget for Michigan's residents. So now we will turn our attention and focus to this year's executive recommendation. Governor Whitmer's fiscal year 2025 budget continues to put Michiganders first with significant investments in our families, education, the economy, infrastructure, public health, and public safety. And Laura's budget requests align directly with the overall priorities set forth in the governor's recommendation, as well as our department's strategic plan. Our budget focuses on leveling the playing field for underserved Michiganders, making government work better for all, and furthering the My Healthy Climate goals, among others. So Laura's fiscal year 25 budget recommendation totals $635.5 million gross, of which $296.6 million is general fund, general purpose funding. The recommended budget also includes 1,788.0 classified FTE positions to help us advance our mission as a department. Now, 47% of the department's budget is supported with general fund, but most of this is actually distributed to our local systems that support indigent criminal defense. Only 13% of our general fund dollars are allocated to support Laura's other operations. So even though general fund is the largest slice of this pie, the reality is that most department operations are supported with state restricted funding. Now, when compared to the statewide budget, Laura accounts for 2.1% of the total general fund within the governor's fiscal year 25 recommendation. Furthermore, when we remove the grant funding that goes to our MIDC local systems, Laura's general fund share of the statewide total is less than 0.5%. So Laura's fiscal 25 budget includes several key investments, and they are strengthening protections for our state's vulnerable residents by bolstering our team responsible for nursing home regulation, leveling the playing field for underserved Michiganders by improving access to qualified interpreters for the deaf, deafblind, and hard of hearing community, establishing a first-of-its-kind consultation, education, and performance office that will drive forward Laura's strategic goals, using available state-restricted revenue to invest in our workforce and ensure efficient, effective, and timely services across all of our program areas, improving services to applicants and licensees within Michigan's growing cannabis industry, and last but not least, ensuring the appropriate implementation of MIDC Act mandates, including the newly approved Standards 6 and 7. So let's explore each of these in a little bit more detail. First, for our Bureau of Survey and Certification, I want to highlight an investment of $1.9 million and 12 FTEs to improve the timeliness of nursing home inspections and investigations. This investment further ensures that we can meet the requirements set forth not only in federal law, but state law as well, including compliance with Public Act 187 of 2022, which requires the department to develop a comprehensive quality assurance monitoring system. I want to draw your attention to the report that is highlighted on this slide. In May of 2023, the United States Senate Special Committee on Aging released a report entitled Uninspected and Neglected. And this report examined the capacity of state agencies to conduct nursing home inspections. The report identified that staffing shortages, underfunding, and burnout contributed to nursing home investigation delays. And as a result, it is recommended that Congress and the states invest in robust nursing home oversight, expand opportunities to enter into and remain in the healthcare workforce, and also improve mental health resources for those within the healthcare workforce. Now, the investment for BSC in the LARA budget is critical to addressing the growth in our state senior population and preventing future cases of abuse and neglect. Now, secondly, the governor's recommended budget includes $800,000 to improve access to qualified interpreters for the deaf, deafblind, and hard of hearing community. The Michigan Qualified Interpreter Program serves over 700,000 individuals, which is approximately 7.4% of the state population. However, the QI program is currently underfunded, and there are only 995 qualified interpreters who hold Michigan certification. Of this number, 528 of those individuals currently reside out of state. So this funding will support efforts to reduce barriers to testing, improve our passage rates, promote interpreting services as a career path, process certifications and renewals even faster. And this will also support enhancements to an outdated QI registry database that is difficult for users to navigate and, believe it or not, still relies on paper forms. So I want to draw your attention to the headline that's on this slide, because in March of 2023, the United States Supreme Court unanimously ruled in favor of Miguel Luna Perez, who was a deaf student that sued his Michigan school district for not allowing him to graduate after failing to provide him with a qualified interpreter. This case underscores why increasing access to an adequate supply of qualified interpreters is critical to advancing equity for our Michiganders with disabilities. Thirdly, by leveraging state-restricted revenue that is already available to the department, this budget includes $400,000 to establish the Consultation, Education, and Performance Office. Now, this is an initiative that we began developing in the fall of 2022, and it is one of my babies, one of my highest priorities. And that's because at LARA, we are committed to educating before we regulate. This is something that my predecessor always talked about. And this investment will help centralize educational resources across all LARA bureaus, expand educational outreach and consultation efforts to both licensees and stakeholders, and promote career opportunities and pathways within the professions that LARA regulates. Moreover, this initiative will help make government work better for Michiganders by enhancing our department's organizational performance management efforts, so dashboards, data, and performance metrics. Additionally, this budget includes an initiative to support health equity by investing $250,000 one-time state-restricted funding to support a research study assessing the impact of the implicit bias training requirement for Michigan's healthcare professionals. This requirement went into effect in June 1 of 2022, and LARA has committed to conducting an impact evaluation in fiscal year 25 once all of our health professionals have gone through one licensure cycle and received their training. Our goal is to utilize the competitive bidding process to identify an outside research entity that can assess the overall impact of this policy, identify any unanticipated consequences, and propose recommendations on how we can improve the policy moving forward. Now, investing in that LARA workforce. I want to highlight that the governor's executive recommendation includes a total of $8.5 million in available state-restricted revenue and 12 FTEs to ensure that we can continue to provide effective, efficient, and timely services throughout the department. So what does that look like? Well, the Bureau of Construction Codes will be supported with $4.4 million and 10 FTEs to improve the timeliness of our elevator inspections. And that same bureau will also be supported with $1.5 million and 2 FTEs to improve the complaint response rates for the residential builders program. Now, these investments are key because they are part of the corrective action plan that we submitted, and that corrective action plan will help remediate the audit findings issued by the Officer of the Auditor General in our October 2021 BCC audit. For our Bureau of Professional Licensing, there will be a $1.5 million investment in additional authorization to support staffing and administration of our health and occupational licensing programs. This investment will allow us to align our state-restricted funds much better and free up existing resources to provide the Bureau with greater flexibility to increase resources to their greatest area of need. This investment will also include $550,000 to improve processing times for our Corporations, Securities, and Commercial Licensing Bureau. You'll be pleased to note that the number of active businesses in the state of Michigan has grown by 20% over the past 3 years. And so this investment is needed to support increased workload demands on our staff and make sure that we facilitate the effective formation of business entities in our state. And finally, investing in our LARA workforce, the governor recommends $562,600 to ensure that the Michigan Public Service Commission can provide adequate staffing across various programs, including the call center, their customer outreach unit, and various caseworker services. Now, to enhance the services for our cannabis regulatory agency, this budget provides $3.4 million in available state restricted revenues and 9 FTEs. This investment will include $2.0 million to absorb the costs to licensees' use of our statewide monitoring system. So at present, licensees are required by state statute to record all marijuana cultivation, processing, transportation, testing, and sales information in a statewide monitoring system. And to access this system, the licensees have to pay a monthly user fee of $40. This budget adjustment would essentially cover the licensee's cost of using this system so that the only thing they are paying to LARA is their licensing fee. This investment for CRA also includes various staffing-related enhancements in response to increased workload within the growing cannabis industry. So in 2023, for example, the CRA saw a 14% increase in the number of licenses issued and a 19% increase in the number of complaints received. As a result, the executive recommendation includes funding to support CRA's staff in combating illicit activity, performing financial audits, enhancing customer services to our licensees, and performing fire inspections of our licensed marijuana businesses. These investments are critical to ensuring effective regulation of the cannabis industry. And I want to share that last year, the state of Michigan was recognized as the #1 state for cannabis businesses. And as a result, regulators throughout the country are now turning to our agency to better understand how to respond to the challenging and changing dynamics of this industry. The proposed investments for the Cannabis Regulatory Agency will further enable them to be a national leader within cannabis regulation. Now, this budget continues to invest in our state's public defense system. This includes $12.9 million general fund to provide grants to local indigent defense systems to support compliance with recently approved MIDC Standards 6 and 7. Standard 6 limits an individual public defender to no more than 150 felony or 400 misdemeanor cases per year. And that's so that attorneys can have adequate time to prepare for and effectively represent each of their clients. Standard 7 establishes a minimum standard of qualifications and review for all of our public defenders. Furthermore, for the MIDC, $24.6 million general fund is included to support local system compliance with other existing standards. And this request aligns with ongoing state appropriations as well as the Commission's approval of local compliance plans and their associated costs. The executive recommendation includes available state-restricted funding to support recently enacted legislation by this legislature. $7.1 million is included to implement legislation that establishes a 100% clean energy standard to be administered through the Michigan Public Service Commission's integrated resource planning process. And $1.1 million is included to implement Public Act 273 of 2023, which requires LARA to administer a medication aid training registration program. And it should also be noted that fiscal year 2024 contingency transfer requests were submitted to support these initiatives within the current fiscal year. Now, before I close, I'd like to briefly comment on one of LARA's long-term fiscal challenges. We all know that inflationary costs have gone up, and they have done so tremendously since the year 2003, which was the last time that most of LARA's occupational licensing fees were adjusted. This has placed significant pressure on the department's overall budget, as well as the budget for our Bureau of Professional Licensing. The expenditures needed to support our programs and effectively regulate the more than 200,000 occupational professions vastly exceed the average annual revenue that LARA collects from those professions. And the Licensing and Regulatory Fund, which is a state-restricted fund, is actually projected to be in deficit in fiscal year 25. This jeopardizes our ability to maintain high-quality services, such as issuing licenses, performing routine inspections, investigating complaints, taking enforcement actions, and supporting numerous occupational boards and commissions. Now, there are several legislators who have already engaged with our department on this issue, and for that we say thank you. And we welcome and encourage continued dialogue with everyone on this committee regarding potential fee adjustments, as well as inflationary language, such as we already have for our public health professionals, and other creative solutions to best address these long-standing issues. In conclusion, we have outlined how this budget makes strategic and fiscally responsible investments in Michigan's future by growing our economy, reducing barriers to licensure, protecting public health, safety, and welfare, and enhancing the customer experience. I am personally committed to building on the progress that we have made together in providing results for the people of Michigan, for our residents, and for the businesses that we serve. Me and my team are ready and willing to support the important work of this Appropriations Subcommittee. So thank you again, Mr. Chair, for the opportunity to present our fiscal year 2025 budget, and I am happy to entertain any questions that you or members of this committee may have. Thank you.
Thank you, Director. Members, questions? Representative Morse.
Thank you, Chair. Thank you, Director Brown, for that clear, informative presentation. First, a comment. I'm happy to see the research study on implicit bias training moving forward because as Chair of Health and Human Services budget, we just last week had the maternal infant health hearing, and it's really dispiriting to see, even though the investments have not been being made that long, the racial disparity in maternal infant health continues to be elevated, despite the fact that we are making some improvements there and seeing our numbers improve. So I will anxiously await the result of that study. I do have a question. So also in my budget, we have had a request for increase in the ombudsman program, specifically to add 30 ombudsmen to the state. At this point, we have the worst ratio of ombudsmen in the aging services area. So my question really is related to your the funding to improve nursing home inspections and investigations. How much do the ombudsman impact that system, or how much interaction is there between the two departments with the ombudsman who hear the complaints directly from the people, and how does that translate to what the work that you do?
Certainly. Thank you so much for the question, Representative. The Ombudsman's Office we view as a partner when it comes to regulating our long-term care facilities. We make sure that all of our providers are aware of the Ombudsman's Office, that they can submit concerns directly to them in addition to filing complaints with our department. When we look at long-term care facilities overall, we have a very unique setup within LARA in that many of our facilities are both state licensed and federally certified. And so LARA exists as the state survey agency for the Centers for Medicare and Medicaid Services. And so when we go into a facility, if they are federally certified, we are utilizing federal regulations to make sure that they are in compliance. On the other hand, we have a state team that works with all of those federally certified and state licensed entities. And it is the state team that actually has a little bit more flexibility when we talk about educating before we regulate and consulting with those providers. And so that team actually goes in and does some additional work in training and consultation. The specific budget request is actually on the federal side. And that is because that team has seen a higher, just as our LARA employees have incurred burnout, incurred lack of resources, going back several years, we've also seen an increase in complaints with the licensed long-term care facilities. As those complaints go up, we have to go in not just for our standard certification, but also for additional complaint investigations. And so it's really a continuum in that anyone who's impacted, a family, they can file a complaint with LARA directly. They can also let the ombudsperson's office know they are an advocate for that family, and we very much work together. The ombudsman's office will regularly request records from us to know what's going on in all of the facilities, and we regularly get letters and communications from them to make us aware of what's going on the ground.
So do we get federal funding for the fact that we are going in and ensuring that the federal rules and regulations are being followed?
Yes, we do. We receive federal funding, and we have actually submitted a request to our congressional delegation for the past several years to increase that federal allotment. I just submitted a letter to our congressional delegation recently to ask again that the federal government increase the portion of funding that we receive to support this program. I will compliment this legislature on your ability to pass a budget, because we know that in DC things operate a little bit differently, and as a result we've seen continuation budgets, which has impacted our ability to receive the increase in requested funding. And so as a result, we've put forward a budget request because it is responsible for us in carrying out this work to make sure that we actually have the team and the resources to do it. I hope that the federal government will support us in this, but I'm coming to you as our Appropriations Committee to say we need to do this from a state level.
Representative McKinney.
Thank you, Chairman. Congratulations, Director Brown, on the new appointment. I have a comment and then a question. So it's very encouraging to see, nursing home inspections and investigations, money being put towards that. I just had recently some nursing home workers come to my coffee hour and talk about some of the issues that are still very prevalent and have been exacerbated by COVID. The staffing ratios and things of that nature not being adhered to, and the workload. And we've recently passed some legislation with the industry and the unions to try to, mitigate that. But what's going on is, we got nursing home facilities that are, we have elders in our nursing home facilities, which is still true. But a lot of times people not realizing that people with mental health challenges are being put in the nursing home facilities because we just don't have enough mental health beds. And so that's a challenge within itself. And so to, see this type of funding being put in for monitoring and inspections is, I'm wholeheartedly in support of that. My question would be, it's a side note, but I'm not sure if you heard the news recently. About 10 days ago, There was a big news story out of Detroit that happened in my district with the hookah shop, tobacco shop, that was sold marijuana to a underage kid, a high school kid. He was 15. And the community came together, the city came together. They ended up shutting down the facility. However, the community, rightfully so, has been calling on their license to be revoked at the state level. And so, I don't know if you can shed some light on the, policies and procedures of the department to, any things that need to be reprimanded or anything like that. But I would love to work with you, offline to figure that out, because that should not be happening under our watch or just period. So just wanted to put that out there. I'm not sure if you got any, insight around that, but, we need to make sure that these facilities are, following the rules and making sure that our underage kids aren't getting involved or getting some of these drugs. So just wanted to put that out there.
And thank you for making me aware of that, Representative. I'm not able to speak specifically to what happened in your district. And obviously, we regret that happened. That is not something that should be happening. I will say that we do have representatives from the CRA that are here today, and I also believe that the CRA will have an opportunity to come before this committee. We can set up an opportunity to dialogue with you further. But that's exactly why we are asking for additional resources in the CRA. Executive Director Brian Hanna has made it a priority to combat illicit activity, and as a result, the CRA has increased its disciplinary actions across the industry. And so these resources that we are asking for in the 25 budget will embolden and help the CRA to do exactly that and make sure that incidents like occurred in your district are not happening throughout the state. And so I appreciate you sharing that with me. We will make sure that the CRA is taking appropriate action on that licensee based on the facts of the incident, and we will certainly work with you and the rest of this committee to make sure that those types of things do not transpire in the future.
Thank you, Director.
Thank you.
Representative Schutte.
Thank you, Chairman Skaggs.
Again, congratulations, joining my colleagues in the much-deserved full title that you're now serving in, and the Oscars are later this month or next month, so we don't need any more acting. So there you go. All right, bad joke. So wanted to ask a question regarding elevator inspectors. Doing my back of the napkin math here, with $4.4 million in funding and authorization for 10 FTEs, that's around $440,000 per FTE. Is that the going rate for elevator inspectors these days?
So despite the fact that our elevator industry is challenged, it's challenging for us as the state to attract and retain elevator individuals with elevator inspection credentials to work at LARA. That is actually not the going rate. I'm going to allow my Director of Finance and Administrative Services to speak a little bit more to that investment and kind of what we're trying to accomplish holistically with not only our existing resources, but the funding that we're asking now and even some funding that we may be looking to in the future. And then we can certainly follow up with any additional details we need for you, Representative Schutte.
So, Representative, the 10 FTEs is actually beneath the need. The need is closer to 30 inspectors as we try to project out the workload to address the backlog that was identified in the most recent audit findings. We're trying to be prudent with our FTE growth inside the department, so that's why you only see a request for 10 new FTEs. We want to first fill the unfunded vacancies, that we do have in terms of current authorization for FTE levels within the budget before we ask for any additional FTEs to be added on top of that. So that's why it's not the going rate. And that's why your calculation is a little bit higher, but we can provide you the additional detail on that per employee cost as well.
And then second question is regarding the follow-on study on implicit bias training requirements. Are you going to be publishing the results of that study?
Certainly, yes. Whenever we do studies or task force recommendations, we make those available to the public. I am very interested to see how that policy has played out. Just to give a little bit of additional backstory on this, the recommendation for that implicit bias training requirement came out of the Michigan Coronavirus Task Force for Racial Disparities. And the recommendation was made by that commission. We then went through an exhaustive administrative hearings process, including significant stakeholder engagement on the front end to get buy-in. Then we implemented the rules. They've been in place for about 2 years. We've been making tweaks as we go along based on real-time input from our various professions. But we committed to that Coronavirus Task Force on Racial Disparities that in addition to putting this requirement in place, we want to make sure it was working. And if it isn't working, we want to make it better. And so that is why you see that request of $250,000 one time.
Thank you.
Thank you.
Representative Brixey.
Thank you, Mr. Chair, and thank you for the presentation. Could you tell me a little bit about the Michigan Saves program and why that was changed, and elaborate a little bit on what the department and the governor are thinking there?
Certainly, and thank you for the question, Representative Brixey. Over the past 3 fiscal years, our department budget has included varying amounts of appropriations for the Michigan Saves program. This is a non-state entity that affords businesses and homeowners with affordable financing to engage in environmentally friendly or energy efficient projects. And so as we move forward to pursue the governor's climate goals, in previous budgets we have supported pass-through funding that went to MI Saves and allowed them to leverage that funding for additional resources. I will piggyback on the comments of State Budget Director Jen Flood, who indicated that this year's budget is a little bit more of a return to normalcy in terms of the number of projects and entities that we can fund, particularly outside of state government. And the State Budget Office also worked with us to identify areas that were previously one-time funding, but were treated as ongoing expenditures. And so every year we look at one-time funding and we identify whether that's something that fits within the priorities and goals of this budget year. And as we did that review, we looked at previous years of funding. I believe it grew from $1.4 million to in excess of $5 million over 3 fiscal years. And we made the decision to invest the limited resources in other areas in this year's budget. Now, I will also say, and I shared this with Chairman Skaggs when I met with him previously, I understand that the budget development process is a negotiation with the legislature. And while I am advocating for this budget that we have put together and that the budget that Governor Whitmer has recommended, I understand that there are other priorities that this legislature and the Senate may also have. And so I look forward to engaging in additional dialogue with you and with your counterparts to make sure that what comes out of this process is representative of all of our priorities, but also puts the department in the best position to respond to our immediate needs and our strategic goals.
Thank you.
Representative DeBoer.
Thank you. Director Brown, welcome. And
Thank you.
glad to see when a character precedes achievement. Sometimes things happen the other way around and we aren't served near so well. So I respect your long journey to get to this position. A couple things that I appreciated in your presentation. The concept of educating before regulating, I think, is so important. When we have expectations of people and businesses and organizations before they understand them, then we have a very poor relationship when things don't go right and we arrive to regulate. So I think that's really a great perspective to have. And I know in the military, whenever something goes wrong, there's a failure. It's the first stop is the training manual for where did we fail in training the people. And so that's such an important concept. I appreciate that. And it's a humble way to regulate. Also, I appreciate your award ceremony. I think you said it was the first award ceremony. That is great because when your team has to regulate people, it's not the friendliest kind of position to have. And someone, doesn't usually have a bouquet of flowers for you when you arrive at the door. So building relationships within your organization, I think, is really important, and to establish a positive culture and to build into each other. And I think that is the best way then to extend a positive world of customer service, because people feel like a team, they feel like you have a family, and then you step out of that to help other organizations and businesses be effective and to serve the public appropriately. And so I appreciate the principles that you're already establishing as director. Thank you.
Thank you so much, Representative.
Anyone else? Great. I just have, Director, a few follow-ups, I suppose. One, to follow up a little bit on what Rep. Schutte was discussing about elevators. Can you go into a couple of different aspects of that in some more detail? Number one, the problem. So what is the level of backlog that we're having in our elevator inspections? And then two, this is restricted funding, if I'm correct.
Yes.
What will that entail as far as an increase in the fees for elevator inspections?
Thank you, Mr. Chair. This is one that I'm going to tag team with my partner in crime here. But let me just start out by saying we realize that elevator inspections has been a systemic challenge for our department going back several years. This is not a problem unique to this administration. We have just had a difficult time maintaining the ability to regularly inspect elevators throughout the state and keeping enough staff to do that. And so let me just first, before we go into the existing requests, thank you, Mr. Chair, and this committee for the investments that you've already made. I know that there were some targeted investments in last year's budget. We've been trying to aggressively fill vacancies within our elevator inspection program, and the funding that we're asking for in 25, which is state restricted funding, will help us to hire additional inspectors. I shared with you, Mr. Chair, and I want to share with the committee, I attended a new employee orientation last week, just kind of wanted to drop in to welcome our new folks. And in that room, we had 3 new elevator inspectors. That is huge. I've been on an elevator inspection last fall. Never rode on an elevator on top of the elevator before. But that is serious work. It's hard work. And we want to make sure that we're doing that work justice. So I'm going to ask Dan to talk a little bit more about the backlog and where some of the funding that we're asking for is going to be going.
Yeah, so Mr. Chairman, in terms of the problem, the Auditor General report cited a significant backlog in the elevator program. It's around 1,200 days. We'll get you the exact figure. But as Director Brown alluded to, this is not a new problem. It was actually repeat finding from almost a decade prior. We're continuing to try to address the significant challenges that we face around recruiting, retaining, and having adequately skilled and credentialed inspectors inside of the Bureau of Construction Codes. And so what this proposal does is it provides the department the needed authorization in the restricted funds that we believe that we will have available over the course of the next several years through a combination of 2 things, really. One, it recognizes the fee levels that were already approved through the rulemaking process in 2023. And then 2, most importantly, allows us to hire up to a level where the program finally becomes self-sustaining. In other words, the more inspections that we're able to conduct, the more elevator fee revenue we're able to collect. And therefore, we are able to accomplish both goals at the same time of making the program self-sustaining and getting on track with being both current in our inspection timeliness and addressing the backlog that has long existed, within the department. In terms of what those fee levels are that were approved through the rulemaking process in 2023, we'll have to follow up with that exact amount as well.
Okay, great. So we could, I think everyone on the committee, we're just pass along to those issues that Representative Schutte brought up. Second, can you go into a little bit more detail about where we are on the CRA lab? And then second question on cannabis, what's the thought process behind pulling back those $40 a month fees? What's the goal in mind?
Sure. I'll start with the second question, and then Dan will respond to the first question. So there is available funding within the various marijuana state restricted funds to support that particular investment. We feel that, legally we are able to cover this. When the program first started, it wasn't something we were actively considering, something that we were sure we could do. We just saw it as an expense that the licensee would absorb. As we look across the department, there are other professions that utilize our various IT platforms, and there is no additional fee for that. We thought that $40 a month was something that was worth taking a look at when there's room in the fund balance, and when there is an opportunity legally to do something to lower costs for Michiganders, which is a proponent of Governor Whitmer's budget. We felt it was prudent and beneficial for us to do that, and so that's why you see, I believe, that $2.2 million in there to lessen the cost to each individual licensee. I'll let you take it.
Mr. Chairman, in terms of the CRA lab, we are making progress. We're only, a little over the first quarter into the fiscal year, especially leveraging the one-time appropriation that was appropriated in the 24 budget. But planning is underway. The first equipment delivery orders were processed for analytical chemistry testing instrumentation, which is a critical component of the ask for the new equipment to properly operate the lab. We're also in space and planning design in terms of being able to move forward with the build out of the facility. Blueprints are almost complete, so that's why we anticipate being able to take next steps as early as March and April in that regard. The safety manual has been finished, so those are forms that are required for quality assurance and accreditation on the laboratory. And then following, fast follow on all of the physical infrastructure work will be the actual operational side of hiring the personnel that we also have the budgetary authority inside the 24 budget to move forward with. So all of those steps are happening actively, and we're happy to follow up with as much other detail as the committee might need in consultation with CRA.
Wonderful, thanks, Dan. And then my last question on the slide on fiscal sustainability. Yes, I too welcome a continued dialogue on potential fee adjustments and inflationary language. We'll be getting to that, I assume, as we dive a little bit closer into boilerplate, but I'll look forward to your recommendations on that. Last call for questions. Wonderful. Just a couple of notifications for members and the public. Our next meeting will be next week, March 5th, where we'll be having the Michigan Indigent Defense Commission. My office will be sending out a little bit of homework. That is the MIDC annual report and the report that we asked for in the last boilerplate on standards 6 and 7, so that we can dig into this extremely important program, but a program with substantial dollars assigned to it. So hopefully you will be able to take a look at that before we meet again next week. And there being no further business before the subcommittee, we are adjourned. Thank you very much.